Hello, good morning, everyone. I'm Stephanie Miller, Director of Major Gifts here at Animal Humane New Mexico, and it is my pleasure to welcome you to our virtual town hall to share news, insights, and updates about the work of the donor-subsidized veterinary clinic. If you are joining us this morning, it is because you are a friend and supporter of the clinic, either through your donations or through volunteer time. All of the wonderful work you are going to hear about this morning is made possible by you, our caring and dedicated volunteers and donors. So our sincere thanks to you and appreciation from all of us here at Animal Humane New Mexico. Our session this morning is being recorded, so we will be following up with an email that will include a link to that recording. We have a lot of information to share with you, so unfortunately we will not have time for a Q&A session, but this slide is showing my contact information. You are welcome to send or call me any questions or comments you have. This information will also be in that follow-up slide I just described. You can also use the Q&A function here in our Zoom presentation, and we will pick up any comments or questions and be sure to follow up with you. After our presentation, we will have an exciting announcement about a matching gift opportunity to benefit the clinic. And then we will be giving you a live behind the scenes tour of the clinic while it is open and operating this morning. So you will definitely want to stay tuned for that. And now I'd like to go ahead and introduce our speakers, and then we'll hand it over to them. Dr. Rebecca Yarney is our clinic medical director. Dr. Yarney has been with us for 10 years. And Val Wilson, who is the director of veterinary operations, she has been with us for 6 years. They work very closely with our other two staff veterinarians, Dr. Tomomi Lager and Dr. Kim Hamble. And between the four of them, they have a wealth of knowledge and experience in shelter veterinary medicine, as well as a great deal of love and compassion and caring for the many pets and people that they help every single day. So now I'll turn it over to them. Please take it away.
Good morning, everyone. I'm Val Wilson. I'm going to take my mask off here for a few minutes. Thank you for joining us. Dr. Yarney will be joining us shortly. She was just finishing a dog spay. So she'll hop on with me up here. I'm going to share my screen and start our slideshow. Dr. Lager was unable to attend this morning, but she did want me to tell you all hello and that she appreciates everyone being here. So this morning we're going to start discussing five challenges that our clinic and shelter faced over the last year. So the first being when shelter in place started and what was considered essential and non-essential last year back in March. Then we'll go into the amount of more diseased pets we saw in the shelter, the availability and cost of personal protective equipment, as well as medications, drugs, and supplies. We'll talk about the change we made to accommodate curbside appointments. And then last, we'll talk about problems we had with staff retention. So last year, on March 23rd, our state and governor deemed that veterinary medicine and animal shelters were considered not essential in our state. This was a huge problem, and we really went into a little bit of a panic across the veterinary clinics. The mandate stated that we could only offer emergency care. That also meant that we could not do any type of spay and neuter for our shelter-owned pets or for our trap, neuter, or return program. We eventually saw the ramifications of this as the year went on, with higher amount of communicable disease in our neonate and foster age pets. We saw more emergency surrenders taking place. When this happened, shelter pets went into emergency fetch some fund and purcation, regardless of their sterilization status. And Dr. Yarney is here. Let me just so you can say hello. Hi. Can you all see her? Oh, let me get the video. Here's the video. Hold on real quick. It should be here. Well, I'm going to continue going, and hopefully we will sort that through here shortly. So because in March, when we stopped our spay neuter, we did see about a 21% decrease compared to 2019 numbers. We eventually were able to resume TNR in June of 2020. When we were allowed to start spay and neuter again, we prioritized our shelter pets that were already in their adopted homes, as well as any shelter pets that were still on campus. So we prioritized them to get sterilized first, and then we eventually opened back up to TNR. So like I mentioned earlier, because spay and neuter was suspended for a few months, we did end up seeing a lot more communicable disease in our shelter pets, specifically in our kitten neonates. When most of the shelters, when we were stopped for transfers, we ended up accepting any sick emergency neonate intakes as far as stray and owner surrenders that were found. We offered treatment through our foster care program. We started utilizing Kitten Thursday for spay and neuter in the clinic. This meant that kittens that were out in foster care who were of age and weight came back through the clinic rather than going through the foster care office. They would come on a Wednesday evening and be dropped off by their foster caregivers. They would get all of their boosters and then be sterilized the next morning. The foster caregivers would then pick up those same kittens that Thursday afternoon, and then they would have an appointment for the following week to drop them off at the Westside Adoption Center. So what this did was help have fewer pets on campus that needed post-op medications as far as their pain medications, and it allowed the foster caregiver to recover and tend to their kittens, which is really great for them to be able to have that opportunity. So we ended up doing this for several months until we were able to get the shelter population to where we needed it to be.
Oh, the other great benefit to that is that oftentimes these neonates, or when they're finally of age to be spayed and neutered, and they come back and they have their surgery, is that sometimes there's so much a recrudescence of their illness that can occur. And our wonderful foster care manager had partially come up with this idea with Dr. Lager, and a lot of the kittens, once they can still go home to their caregiver, it really greatly reduces their stress and their potential for forming more illness and upper respiratory signs, and continues them to stay adoptable and not have to go through another course of treatment.
So the next part we're going to talk about is the availability and cost of personal protective equipment and other supplies and medications that we use in the clinic. When COVID hit last year, we saw many things that we usually really take for granted, had taken for granted, things such as medical grade surgical masks, sterile surgical gloves, exam gloves that we use frequently throughout the day, surgical gowns, really anything related to the surgical suite. We even saw back orders and shortages of surgical blades. And so we really had to take a look at what is our current stock and availability, and what changes are we going to have to make due to these shortages. Dr. Lager created a COVID SOP for PPE usage across the campus. Essentially, it was reusing gloves until they were worn out and properly washing in between pets like we normally do with the gloves on, reusing isolation gowns, again, until they were worn, and hanging them, disinfecting them, but making sure that we were reusing them. We ended up seeing and still are incurring a huge increase in cost of certain items. For example, before COVID happened, we used to pay around $6 per box of gloves. After COVID started, we saw a huge price increase. They now range anywhere from $17 to $24 per box. As far as what the impact of this, we typically every month spend close to $200 on gloves. With this new price increase, we're spending around $700. So annually, we're seeing about $6,500 difference of what we're paying for just clinic gloves. Gloves are used pretty much in every department on our campus. So we're really seeing price adjustments and changes that are affecting and impacting the organization. You want to talk about protocols?
The other situation that occurred for us is drug shortages. We had to change protocols initially and have continued to stay with those altered anesthetic protocols due to difficulty obtaining midazolam, ketamine, hydromorphone. We had to switch over to Tilazol, which is a primary pet cost. So the ketamine and midazolam roughly was about $5 for the bottle of ketamine, $6.50 for midazolam. Tilazol costs, but the costs rose exponentially for those medications, or they just weren't available. Tilazol costs almost $73 a bottle, dexdomitor $190 a bottle. We've tailored it to try to lessen as much of those drugs as we need and still get a good anesthetic plane, but we're not sure when we're going to be able to return to some of our previous protocols. Hopefully that will adjust, but it's been a large financial impact as well to adjust to those other veterinary friendly drugs that aren't being utilized in the human medical field at this moment.
Some other impacts we saw with changes and adjustments to our anesthetic protocols really affect the staff and our volunteers. As most of you know, our volunteers are, we have volunteers for our anesthesia recovery of our surgical pets. And so anytime we adjust our anesthetic protocols, pets can have different side effects that our volunteers may not be fully comfortable with or know that that's going to happen. So it trickles all the way down, not just from a financial standpoint, but down to staff time and volunteer changes. It can really impact them.
Sure. So the other main change that happened with COVID for us was staff retention. In the beginning, we lost several experienced technicians, often choosing to move out of state to be closer to family and support systems. And there are a couple other various reasons in terms of forming family and needing to change work hours due to COVID. Also during this time, there's been a lot of difficulty recruiting experienced and versatile techs. In part, there's clearly some discomfort in switching jobs if somebody has a current employment, or people have to stay home to take care of family members or their children. So that's been a major challenge. We've had difficulty training new lead surgical tech. So that's a main position. We promoted one person up into a managerial seat, but in terms of having newer technicians, some of whom have experience but don't have longevity within our team, to try to elevate them to a status where they could be a lead surgical tech and kind of run the floor. That's been a big challenge. And, unfortunately, some of the qualified people that we have had some, medical concerns and other issues. So it's been a lot of negotiating. We also have had some staff that, particularly during the surge of the virus, that were either going to quit because of discomfort within their family, risks within their family that they wanted to protect them from. So we retain those people by giving them some part-time hours, but those have been sacrifices we've needed to make to continue working to the best of our ability, but also accommodate varying needs for those staff members.
Also, to talk about this, there have been a lot of challenges within our registered veterinary technician program and our PIMA veterinary assistant programs. Many clinics in the community are not allowing those students to gain their externship and hands-on skill and knowledge. So there have been candidates that are straight out of PIMA, for example, that graduated, but unfortunately they never completed their externship. And so that makes it a challenge to bring in those types of candidates and assistants into our clinic, specifically due to the fact that they haven't had that hands-on type of work and skill set yet. All right, we skipped one a little bit here, but we're going to go back to curbside appointments.
Clearly, one of the biggest challenges in terms of running a donor-subsidized low-income clinic has been the appointments and turning those into curbside. And there was, on March 23rd, full closure of all operations through the 31st. At that point in time, we were deemed non-essential due to COVID-19. Then once we were able to become essential, they're still only allowed for urgent or emergent needs in with an active veterinary client-patient relationship. So we began allowing curbside drop-off appointments for those essential needs during that time. At that time as well, luckily, most of us might be foggy in our memories, but we were in two split teams due to quarantine, an A shift and a B shift. So we had limitations with how many people were in the building and could be there. In April, we began offering some telemedicine appointments, but it was pretty difficult for our clients and the veterinarians to diagnose pets due to acute chronic cases. It helped a little bit in terms of some of the phone call management. I mean, at that time too, we were trying to mail out medications to clients to reduce them coming to the building and to pick up meds. In June of 2020, we started offering curbside care appointments for current as well as some new clients. Our current client base was not always in need, and there were plenty of new clients that had issues they needed to have addressed. The clinic team has had to adjust our operations and capacity of appointments, and that's been throughout the country. It's why it's very hard to get into veterinary clinics for appointments right now. There's a much longer wait list, even for just wellness care, new pets needing vaccines. There's been a large backlog. And a lot of it's, this inefficiency. So if a client comes to the building, then they have to wait in their car. The technician needs to, phone, ask the intake questions, bring the patient into the room. We do our exam, create estimates, and then have to call the client again. From there, the receptionist has to call the client to take the payment, to then discharge, and then with medication. So it's a rather cumbersome process when there's a lot of going in and out of locked doors and trying to limit some of those interactions. Some of these have been really upsetting because some of the diagnoses of, say, a new patient or even an old patient with a really bad cancer can require, something you don't want to discuss on the phone. And so there are times accommodations to go outside and speak with clients, which unfortunately on our address is occasionally challenging because we have other members of the community that occasionally show up and need emergency services and have no finances for those services. So they're early on, and particularly with COVID, we were having some of those moments. So we started 4 parking spots on the side of the building so that the clients can go over to the side of the building rather than be parked out on Virginia Street, where we're more visible to people that are just driving by and, come out and say, well, you need to help me, you need to help me. And then they get a little bit upset if we can't help them at that moment and can have some pretty negative words. So we established that side parking lot, which has actually really helped because they're a little bit more hidden, but that still is a whole process of going from the front door to the back door and figuring out where people are, trying to make sure clients are answering their phone or they're not on their phone with something else, or their battery isn't dying, or if they have to go to the bathroom, what do we do with, individuals that have been waiting for a long time that suddenly have to, have those issues. So it's been a process, as well as just with a newer staff, trying to make that a fluid process when you're training some folks who are experienced and then some who are not. It's a work in progress. It's getting better.
So currently we are only servicing about 65% of appointments compared to where we were pre-COVID. So like Dr. Yarney mentioned, this is pretty typical across most veterinary clinics, which is why there's such a backlog. We have changed a few things as far as the workflow with curbside. We have created more workspaces in the clinic that provide some a discrete location as far as being able to have those sensitive conversations with clients and the challenges of the loud noises in the background and all of that. We are currently looking to find cloud-based veterinary software programs that have a little more functionality towards curbside and things like that. But it's definitely been an interesting change. So those are pretty much our top 5 challenges that clinic and the shelter experienced. Of course, there were many others, and we still have more challenges to overcome as things progress with COVID and whatnot. So we have 7 accomplishments that we are proud of. The first is when we last did our Friends of the Clinic presentation, we were about a few months into our restructure of the clinic and shelter oversight. At that point, back in March of 2019, Dr. Hamill had stepped down from her chief veterinary officer position, and the 4 of us really looked with Donna and HR, really looked at how could we restructure the oversight of the clinic and the shelter. So what we did was both Dr. Yarney and Dr. Lager are our clinic medical director. Dr. Yarney is. Dr. Lager is our shelter medical director. So anything that takes place in the clinic building is under Dr. Yarney's jurisdiction. Dr. Lager is responsible for any of the shelter processes as far as intake, management of pets, veterinary care, foster care, things of that nature. And then my position helps oversee both the medical directors and really meshes the 2 together. This helped offload work between offset work between the 3 of us We feel that we have better communication to the clinic team, specifically thanks to Dr. Yarney. She is very much in tune with what takes place among the staff and is very open to and willing to explain processes and changes to each of them. Dr. Lager has created and updated many of the SOPs in the shelter, leading to the success of Sniffy Kitty City, which we'll discuss shortly, triage training for animal care managers and leads and foster care. And she also does annual compliance trainings. Okay, so Sniffy Kitty City. Previously, before we initiated this Sniffy Kitty City in Checkmate 2, we used to release cats and kittens that were in isolation for undergoing upper respiratory treatment. If they had mild symptoms, those cats would be released from isolation and then go into holding, which most of you know, holding is a smaller kennels for them, a lot of stressors involved in that area of people coming in and out, cats coming in and out, all of those things. And so what Dr. Lager did was initiated this Sniffy Kitty City, which would involve any pets, any cats and kittens that still had mild colds, mild upper respiratory infections. Rather than them going into a more stressful environment in H, they would go into Checkmate 2 and into a communal living area where they would be available for adoption with a medical waiver stating that they still have this mild cold, may or may not be on medications. And so rather than the cats getting sick all over again while in H, they ended up being adopted out much more quickly when they were on the adoption floor. Since this started back in 2019, there have been around 200 cats that were adopted out of Checkmate 2, rather than going back into holding, where they would either relapse with their cold and have to go back to isolation, or stay in the holding area for a few days until their colds were fully resolved.
And just on that note, I can't emphasize enough like what a change that has made, because there's always these cats, they're just borderline, or I will release them from ISO because there's no nasal discharge, there's no ocular discharge. And then the next day, there's a vet check-in that they're sneezing. And then you would go to H and go see them, and there might be like a couple sneezes, there might be very mild nasal discharge, and you don't want to have to stick them on antibiotics again because they're trying to get through that last little residual amount. But they often, you get into this factor of, well, if they're sneezing and they're going to expose other people, like what is that threshold? And they would wind up back in ISO oftentimes, or sometimes they would already be moved by animal care. So this different environment is, most of those cats are not on any kind of medications at all, but they might still have just a little bit of those sniffles, a little bit of sneezing. And the doctor that is sort of pre-warned that they're getting over this is much less likely to want to bring them back for said issues. They knowingly understand. And that those communal rooms are just fantastic because they can go outside and interact with each other or not, but there's a lot more opportunity for normal behavior and not having to go back into isolation, which is sometimes for some cats a vicious cycle of 2 or 3 treatments where they could potentially be in there for even close to a month. If that occurs. And of course that decreases socialization and is hard on them when they come out, particularly if they're young. We don't want to have to keep them in that environment when their behavior is really being changed by their interactions with humans.
So the third, it used to be a problem, but now it is an accomplishment, what is our shelter pet dentals. We used to have a very long backlog of pets pending dental procedures, whether they were still in our care or they had already been adopted. We really felt that our standard of care for our shelter pets was not up to par in this particular situation. as most pets were being adopted with painful mouths, diseased mouths, and it just didn't line with the quality and standard of care we have. So what we did was we ended up instituting something where any pet that it deems necessary, a dental is necessary, our assistant manager now schedules that pet for their dental within 24 hours after the vet requests it. There's pop-ups in their shelter buddy profile, so at the time of adoption, the adoption advisors can let the adopter know this pet is already scheduled. You will be coordinating with the clinic team as far as how to drop off the pet and all of those things. So adopters were sort of pre-warned that this is sort of a set in stone appointment. That eventually got us down to now about 90% of pets are being adopted after they've already gotten their dental procedure while in our care. So most are getting their procedure either the same week or within the following week while they're in our care. Something to touch upon as far as COVID and the impact it had, we did see around 20% fewer special surgeries in the shelter, and this was likely due to fewer pets being transferred in from our Project Fetch partners and fewer pets being surrendered due to closure of admissions early on in the pandemic. As far as our donor-subsidized special surgeries, we also saw about a 30% decrease, again, due to closures for those first few months and more clients experiencing financial hardship.
But one thing that has been interesting is I do think we've seen a lot more trauma-related cases this year that have shown up and become shelter pets, either transferred from another holding facility, shelter, or owner surrender fractures particularly. One of the challenges with COVID as well is, especially initially, it's better now, was trying to get those fracture repair supplies shipped in time to aid in the repair and use of some of our foster program to help in the recovery of those pets, where sometimes not everything was ideal and capable of being ordered in FedEx. It is challenging for us to have a large inventory of expensive orthopedics. So sometimes we reach out to other clinics to go and pick up a couple things if they have it. Sometimes they don't have exactly what we need, but sometimes waiting that extra week on the age of the animal or their fracture was also not a good option. So that's been an interesting dance that we've done more times this year than I can remember in quite some time.
So back in March of 2018, we began a new partnership for trap, neuter, return reimbursement with the Zimmer Feline Foundation. It has continued to help us fund private trappers to bring cats to us for TNR, and has also allowed us to develop new relations with other organizations. In particular, we started a new relationship with Heart, New Mexico. They are based out of Valencia County. They are a smaller organization that adopts out pets and whatnot, but one of their main functions also is TNR. They do they're very much volunteer-based that go out and help trap and transport the cats to us, but it's been a great relationship. We're also still happy to continue partnering with Street Cat Hub, which is here in Albuquerque. They typically bring us cats once or twice a week as well. I want to talk about the changes with when we have to stop TNR at all? Maybe?
Sure. Yeah, we didn't touch on that very much.
Not really.
Oh, and Val mentioned it a little bit earlier when I came in, but with the trap neuter release, when we first went into COVID, we were trying to just really push that because it didn't cause a lot of interaction with the public. We could try to impact because that's right at the height of kitten season. So there's a lot of cats that are born around March, April, May. For us, kitten season wound up pretty much lasting till December. It was brutal. And we weren't able for a while to bring in the TNRs. That wasn't deemed essential. And then we restarted that. And then we're trying to really push that to be impactful again, because we certainly saw with the number of sick neonates coming in that it does impact the community when we can't help provide that service. Street Cat Hub has been able to start doing some of their own spay and neuter, so we're not doing quite as many for that organization. And that's why we're also helping partner with Heart, which has been fantastic, because they also, Heart can bring in cats from down in Los Lunas and some of the areas that are a little harder to reach, but certainly have an increased number of feral cats. So that the TNR in our hearts is like a huge part of what we do and what we want to do to help influence cats in the community and reduce some of those numbers of they'll start having babies, you know, by the time they're 8 months old, and it just gets into a very bad cycle in terms of trying to influence that population.
The next is a few years ago, we started an online pharmacy portal to ship medication and prescription foods. It hasn't been as successful as we had hoped for our clients' usage, but we have continued to offer it and did see some growth, especially during the pandemic and while the stay-at-home orders were initiated. For comparison, back in 2019, we only did 43 online orders, but in 2020, we did 166 orders. So again, there's some small growth. I think it's an important tool to have, and I wish that our clients were able to utilize it more, but at this time, we can always offer it, but they would much rather stick with purchasing through the clinic. So thanks to donors and grants, we were able to continue utilizing our PetSave and Angel funding throughout 2020. And these funds help clients and their pets that need veterinary care or humane euthanasia. We helped 98 pets with PetSave, which totaled around $16,000 worth of care. Many of these pets needed either diagnostics for further diagnoses or potential surgeries, upcoming surgeries, many mass removals, amputations,
A broken leg.
broken limbs, dentistry, and most of these pets needed, very urgent care to help relieve their pain. So we're very grateful that we could continue to offer this essential funding to our clients. When the pandemic started, we also used PetSave to help offset the cost of medications and shipping to owners, as many of them were really struggling to pay for their chronic medications for their pets, so for their diabetics, for their allergy pets, and we knew that this was essential in the well-being, continued well-being of those particular pets.
People may have different feelings about some of the stimulus money, so I'm not trying to get really political, but I will say that some of our clients, the thing that brought some of them in with their pets and their ability to pay for some of their care, and I'm sure we're going to see that again, has been that they took their $600 stimulus money and they've been, they know that they have a pet that had like horrible teeth or something of this sort, and they come in and they like share with me, this is the only reason I can do this is because of my stimulus, but it's their pet is, I'm getting emotional, their pet is like everything to them. And there's times where you have clients that you aren't a fan of, but some of the clients, they have been so isolated and they're at home with their pet all the time that their ability to come in, or our ability to lift that burden with the PetSave, makes everyone really feel good. The same thing with the Angel Fund. There's been some tough euthanasias that they'll say, well, I don't have that money right now, and they don't know that we have a fund, but we've been able to say, we can help you. Like, this should not be, a reason that you need to, wait. I had one patient who's been in pain for a really long time, and the client had kept waiting and waiting and waiting. And I found out that that was, happening, and we were able to help her as well. So there's just a lot of really good things that we can do that you can't do elsewhere because of the power of this organization and the amazing donors that help support it. And it really is incredibly impactful.
So something that we did when the pandemic started, we had our A and B teams, and that was across the clinic, adoptions, animal care, foster care. And we really wanted our team to still have some type of interaction and not feel so isolated on their days off. Most people were only working 2 days a week, or potentially 2.5, 3 days a week. And so we realized that we needed something to engage them so that they still felt that they were, with shelter pets and their interactions. And so we asked everyone to do their fear-free certification. So fear-free is a national program. Veterinary clinics can be fear-free certified with their staff, but essentially it provides tools, resources, and webinars for our team to help reduce fear, anxiety, and stress in our pets. So we were fortunate enough to have a silver lining through the pandemic. All of the clinic, animal care, foster care, adoptions, behavior teams are fully fear-free certified, and various staff in the administrative departments, development, and marketing are also certified. So this is a really big success for our shelter and specifically for our pets.
The other thing I would just say in thinking about it, and I know some people on this call are volunteers, and it's not just to pat you on the back, but I do feel like through COVID, our connection with our volunteers, our need and the support of the volunteers. So there was a couple changes in the volunteer base. This particular Monday shift had to change. We had a couple people leave because of COVID reasons, and what that was rebuilt, but that's been vital. And the relationship when we didn't have the volunteers present, or the return, just the actual relationship, beyond just that we have this incredibly over talented workforce that doesn't get paid, those relationships have been really vital to a number of us, and I think to some of the volunteers to see those people and to have this this trust in what we are doing and the support throughout all of it. That communication as well, I think, in having a smaller team and a little bit of a newer team, I think it's enabled us to become closer to our volunteer staff, and the fact that we've been a little bit slower has allowed for better communication there. And I think that that's a really important factor, that sometimes we've often been too busy and not been able to enhance some of those relationships, but that's something I think has been a positive through all of this.
Okay, so what do we have planned for the future? There's a few things. These were just the top 4 that came to mind. We're of course always strategizing on ways to improve our operation, but I'll let Dr. Yarney start with the first part.
So we are still continuing to recruit, train, and hopefully retain our technicians so that we can continue to offer some versatility to our team. A couple of the folks that we did recruit early on are very skilled, and then we have some newer folks that are on have various talents but are in a very training stage. We're also looking to extend the relationship to PIMA to allow an, I guess I don't know if they call it an externship or an internship for some of their technicians. Unfortunately, occasionally we have some things that have happened in the clinic where we have to kind of offset that time or figure out the appropriate time, because if we're training newer technicians, it's not always the best time to bring in somebody even newer. But I think we're finally starting to get to that point. So we are willing to change our mindset about how to bring on technicians that don't have all the skills and train them, but there's a pacing that needs to occur with it for staff burnout, efficiency, and just the ability to properly train during that period of time. We're also looking to strategize ways to increase our staff efficiency and client engagement during curbside appointments. While we know that, at some point we won't always have to do curbside, there still will need to be some precautions. In terms of what we've recently talked about was getting a couple more tablets and doing something called Zoom Room, where the tablet could go out to the client and one can stay in the room. We haven't tried it yet to see if our wireless and connectivity would be good, but hopefully it could be, and that could increase the client's ability to kind of see what's going on in the room, to discuss some things with them, and to sort of speed up that inefficient process of having to stop everything and call and mention your findings, and instead we could go through that with the client. We've talked a little bit as well, Val had mentioned about possibly moving towards a cloud-based version of the software that we're currently using, that would give us some more flexibility. Currently too, let me read this one here. We are still monitoring closely the production and availability of personal protective equipment, controlled substances, and medical supplies. That's been a very touch and go. There's oftentimes where certain foods right now, prescription foods, are not available. Other medications have not been available. And finally, I think as of like 2 weeks ago, we were able to get the surgical masks with ear loops back in. And that was, you don't normally get excited about those things to the same capacity, but everyone's very excited because it enables people to double mask and us to be able to offer that out. So Val's very attentive to working with our various vendors. She's amazing at finding optimal pricing to make sure we don't overspend where we don't have to and can conserve where we need to. Lastly, we're continuing to adjust the clinic and shelter operations on capacity and the schedule so that we can be sustainable and safe, but meet the demands of our shelter pets. The shelter is still a huge priority, and we offer in this balance because we've had an outreach to the community for many years, but trying to take care of our shelter needs, take care of, again, community needs, which is in our mind is partially the TNR outreach, and then these pets that are in greater need. We're trying to continually balance what that equation is. For a while, I think we've gotten to a much better balance, but as things start to open up, I'm sure that will create a little more adjustments that we have to make.
Further discussions that we will have for the future are when do we reopen to allow clients into the building? Does that mean when Albuquerque is green, when we have more staff vaccinated? What is that comfort level and ability to do? I don't think we're quite there yet, but we're constantly talking about it to gain staff approval and whatnot. So that is also something that will be planned for the future. So I hope everyone enjoyed that. Of course, if you have any specific questions, please feel free to email Stephanie or myself. I believe Stephanie has a few things to say, and then I will take you guys on a tour, but I'm going to let Dr. Yarni say goodbye once I start the video. All right.
Thank you very much for being here, and sorry I can't see all your faces in some little Zoom pop-up, but that's probably best for everybody. You can drink coffee while I can't.
Thank you.
Great.
Thank you.
Okay.
Thank you, guys. And thank you, everyone, for hanging in there through our technical issues. We appreciate it so much. I have the good fortune to work here every day, and I can see in person the inspiring work of the clinic, and have seen them go through this very challenging year and everything you just heard, but it still never ceases to amaze me to hear about everything they do. So next, before we begin our tour, I'm delighted to let you know that we, two of our very special supporters, Terry and Tony Pacelli, are offering an incredibly generous matching gift opportunity today. They are offering to match total gifts of $5,000 to benefit all the wonderful work you just heard about. Our clinic's annual budget is $1.5 million. And every year we need to fundraise about a little over $1 million in donations to make up that funding gap. So by offering this very special opportunity, they are hoping to inspire you to make a gift. And we've set up a special giving page. I will share a link with that in our follow-up email. You are also welcome to call me if you'd like to make a matching gift. And thank you to Terry and Tony for providing this very generous opportunity for our clinic. We are very appreciative. And now, as promised, Val, you're going to take us on a tour. There you go. Switch your.
There we go. Okay, good. Hello, everyone again. I've been doing these virtual tours for over a year now, and I've done pretty good reviews about them. Hope you all enjoy this. So as you see more, so clients know that they can't come in. So as we mentioned, curbside has proven to be challenging in its ways. Typically, clients are met outside by the technician or receptionist to either or
Val, we're having a little trouble hearing you. Can you hold it closer to the mic, closer to your phone mouth?
let me see if is that any better?
Yeah, it could have been just the
Okay.
Wi-Fi while you were outside.
Outside, yeah. So this is our clinic lobby. Pre-COVID, it used to be sometimes standing room only in here. We would have many clients in here waiting for appointments with their veterinarian, technician appointments, picking up prescriptions, or just here because they had questions and wanted to schedule an appointment. So now it's a little sad and quiet in here. We are looking forward to when clients can come back in. But at this point, it's an empty lobby. We currently have our 2 full-time veterinary receptionists here. Cheryl has been with us for a few years now. She came from a 911 dispatching background, so she very much can handle high volume calls and the stress of that. Danielle has been with us for a few months, and we were happy to secure her as she was a previous veterinary receptionist. So she had all the knowledge and skill set we really needed. Right now, once a week, they go through a little over anywhere from 150 to 200 voicemails that need to be messages that need to be returned. We are still a voicemail based only system, meaning clients have to leave a message and then the receptionist will call back. Something that we will be changing soon are our voicemail phone tree, where we'll be including a euthanasia emergency line, as well as clients that need medications refilled, or they have questions regarding their pet post-surgery. We'll also have a line for current clients who have questions for their veterinarians or need to schedule an appointment for their pet. And then the last part of the phone tree will be for any new clients that we haven't seen in over a year. So we're looking forward to that change. We have really outgrown our current voicemail system, which we changed a few years ago. but we think that the new changes will really be able to provide a little more customer service. So first thing in the morning when the receptionists arrive, they will check in any special surgeries that are from the donor-subsidized side. So those could be orthopedic repairs, dentals, mass removals, anything like that. The pet will go into one of our exam rooms to get their catheter placed and by the technicians. And then the receptionist will continue checking in clients and their pets for spay and neuter, and then any cats that are here for trap, neuter, return. Around 8 o'clock are when our first appointments start to show up for the shelter veterinarian, who ends up seeing rooms in the morning, and then we'll go out to the shelter in the afternoon for any vet checks. Something that came to be a problem is that our phones in reception do not ring live. And so we really had to figure out what to do when clients show up curbside. And so we ended up creating, again, these additional workspaces that have phones that ring live. So technicians, receptionists, and our veterinarians have a few phone numbers that they can share with the clients to have them call when they arrive curbside, whether that's for an appointment, a surgery, or pickup of food or medications. So we'll make our way to the back. So this is our treatment and room area. Currently, we have 4 exam rooms. As you can see, our exam rooms are incredibly small. There really is no space to social distance, or not enough space to social distance from clients to staff. So one reason, again, why we have opted out of having staff available or having clients come into the building. So we have 3 exam rooms on this side. This is our in-house pharmacy area. We have another workstation here with a phone. So we typically try to script out all of our medications in-house because we have a little more control of our pricing schematic compared to other organizations. Most of the time, if we know that clients can obtain medications for less elsewhere, we will recommend that they go to that particular place, as we want to really encourage our client compliance with medicating their pets, specifically for the health of the pets and the well-being. So this is our second exam room and our third. We also have an in-house diagnostic or in-house lab area. Here we can provide, we can do complete blood cell counts, and we can run chemistry panels, which will look at organ function. We really try to do as many in-house panels specifically for our shelter pets, because a way that this equipment is leased out, we get points per panel that we do in-house. Those points equivalent to a dollar amount that end up going towards the cost of the lease for the equipment. So we really encourage the veterinarians to do as many things in-house as they can, especially since we get results, within the same day typically. One thing that has been challenging with COVID is lack of people available to run these diagnostics. So sometimes it ends up being a little more of a delay to get the test results. We also have microscopes over here. We run a lot of fecal samples, urinalysis, a lot of fecals for our shelter pets. They come in harboring parasites, they get stress, diarrhea, things like that. We also have a lot of stress cystitis in our cat population. This causes urinating out of the box. It's painful, and it does require a urinalysis to take place. In addition, the veterinarians see a lot of lumps and bumps on our donor-subsidized pets. So they do many, many fine needle aspirates where they look under the microscope at a cytology to see if they can detect cancer or any other concerning things that may happen. So as we move our way into the treatment area, this is our treatment area. These technicians right here are inducing what looks like a shelter dog for stay. Typically, all of our shelter pets, normally when they come, will get their microchip implanted as well. They will get a pre-medication, going back to our anesthetic changes, something that we have had to do to change and to ensure that they're getting pre-operative anti-steroidal non-inflammatory medications. So they're actually all getting oral medications before they get their sedation or their pre-medication. And then 10 to 15 minutes later, they'll get induced with other medications. So typically we have 1 or 2 surgeries going on here. We will also have a dental procedure going on here. We do many dentals in the shelter, as well as with our donor-subsidized pets. Unfortunately, many of our donor-subsidized pets have not had the opportunity to have a normal dental scale and polish. So they do come with very diseased teeth, broken teeth. Most of our dental procedures take anywhere from 2 to 3 hours. If we have dental disease in the shelter, we provide dentals for any pets that have a grade 3 or 4 dental disease, periodontal disease, or if they have any broken teeth that might be painful. We are fortunate enough to have a dental radiograph, which is right there, which we'll walk through here shortly. And most of our pets do get dental radiographs prior to the veterinarian extracting any teeth. This helps show any diseased teeth under the gum line that aren't visible to the naked eye. All of our pets that are here for special surgeries or have a higher risk of going under anesthesia or are on IV fluids are in this area. This is Ginger. She's all tucked away in there. She got a dental procedure today. We have her on a bear hugger because her post-operative temp is a little low. And we have another shelter puppy on this side getting induced for surgery. As far as our surgical load, we tend to do about 15 spays and neuters for the shelter, anywhere from 5 to 10 feral cats a day, 4 or 5 donor-subsidized spay and neuters, and then anywhere from 1 to 3 or 1 to 4 special surgeries. So on average, 30 to 40 surgeries per day, which is a very large volume considering the standard of care and quality that our pets receive. The only way we are able to do this many surgeries with the amount of staff is because of our recovery volunteers. Right now, we normally have 3 recovery volunteers in the clinic taking place or helping us. They are trained to retrieve the pets immediately from surgery. They know how to extubate, so they know how to remove the breathing tube and when it's safe to remove the breathing tube. They also know when to alert our lead technician of any slow recovery times, abnormal temperatures post-operatively, or pets that are dysphoric and not recovering smoothly or things like that. So we are very fortunate. Just to let you know, as far as comparisons, private practices that may have 3 or 4 doctors typically only do 5 to 10 at the max surgeries per day. So again, we are a very well-oiled machine with the processes we have in place right now with our anesthetic protocols, the surgical flow. Jackie is our T1 right there, our lead surgical technician for the day. She draws up all of our controlled substances based off of the anesthetic protocols, based off of their age, species, all of those things. She knows who has had surgery, who needs to be pre-medded, who has been induced. She is in constant communication with the technicians, the veterinarians, and the volunteers. So since we do so many surgeries, this is our surgical suite. We typically have 1, 2, 3 surgeries going at a time. Right now it's a little towards the end of our day and we did not have ferals today. We normally have 1 technician in here that's monitoring all 3 tables. We also have a 4th table where cat neuters take place. If And when we have a special surgery, it's typically at this third table. The surgical technician will be in here monitoring that patient, again, where the procedure is a little bit longer, higher anesthetic risk, things like that. So she or he will monitor that one patient, and another technician will come in and monitor the other stays and neuters. And we're gonna follow this pet through to recovery, so you can see our volunteers. That's Carolyn, Dr. Humane here. And we have David coming. David is one of our amazing recovery volunteers. He also helps with some of our orthopedic surgeries. He scrubs them with Dr. Yarni. And we have Nancy, one of our long-term technicians. So they are going to take this shelter dog, and we're going to just follow them so you can see the process here. And we'll come back through these little areas as well here. So again, the clinic environment is very fast-paced, very loud. Most of our volunteers have been with us for quite some time. Again, we would not be able to do the number of surgeries that we do without them. Some of them do have medical background, but that is not a requirement to volunteer as a recovery volunteer. So right now, once this dog is ready to be extubated, he will remove the tube. He might remove his eyes. He's going to take a temperature post-operatively to make sure it's within normal limits. If it's not, he knows what to do as far as the next route, whether that is more wormies, alerting the T1 so we can do drug reversals. They're also going to check the incision to make sure it's nice and clean. And then they will write some information on the kennel card. All right, so we will go back into treatment, bypass a few things. So after we finish surgery, of course, each spay and neuter is going to have their own pack of instruments that needs to be cleaned, repacked, and then sterilized again for the next day's operation. So if we're doing 30 surgeries, that's 30 packs, many, many instruments. And a few years ago, we had the great idea of seeing if we could find any recruitment and interest in volunteers to help in the pack prep area. We were a little worried it might not be much interest, but because of the fact that you're dealing with blood and potentially sharp objects, but we are very, very fortunate to have found amazing pack prep volunteers that come in for 2 hours in the morning. Adrienne is one. She comes twice a week on Mondays and Tuesdays. She also helps in the foster care office. And then we also have a pack prep in the afternoon for a few hours. So here's some of our packs here. Again, this volunteer in particular position is trained by a staff member. Our recovery volunteers are all trained by their lead recovery volunteer. So again, the process of the pets coming to us. So if it is an owned dog and it's here for a spay and neuter or any other drop-off reason and they are not high risk, they come into recovery 1 or R1. Hi, Kathleen. If they're a shelter pet, they come into this R2 area. We intentionally keep them separated from our owned dog population, as a lot of our shelter dogs might bring parasites, kennel cough that we might not be aware of quite yet. So we always want to make sure they're separated out. First thing in the morning, animal care brings all of our pets that are on the shelter list, whether they're here coming over for spay and neuter or for a special surgery. All right. I hope this room is open. So of course we have our laundry room, which is very fun. Typically, trucks.
Oh, Val, we're having trouble seeing and hearing you. I don't know if it's because
Oh.
you've left the building. Oh, there you go.
I'm coming back. So,
Better.
so that room is where our feral cats go after they've had surgery. So what will happen with our feral cats is all of their drugs their sedation drugs get given to them while they're in the trap. That is done by one of the technicians. Then once they are fully asleep and sedated, we will pull them out of the trap. At that point, they will go onto one of the surgical the prep tables. They will get sub-Q fluids to make sure they stay hydrated, an injection of penicillin. They will get their vaccine, so their upper respiratory vaccine as well as their rabies vaccine. They will also get a scan for a microchip. They will get their left ear tipped, which is how people in the community are alerted that a cat has already been sterilized and through the TNR program. And then they will get prepped for surgery. If they need any additional medications, such as flea or tick treatment, they have a severe respiratory treatment, we are fortunate enough that we can provide that treatment and get reimbursed for those supplies. So once those cats are done in surgery, they will actually be recovered by volunteers again. They will go into that room that I was just in, back into their trap. Their temperature will also be taken post-operatively and alerted to the lead technician if there's any low temperatures or very slow recoveries. Because these cats are coming from an outdoor environment and we are unaware of their medical history or pre-existing problems, we have a very, very safe anesthetic protocol that we use for them and a very good success rate with them recovering. So that little puppy is going to go in for her stay. So I'm going to move around to the other side of the clinic. So this is our fourth exam room. It also has a small workstation. We're a little bit further away from the treatment area, so it's a quieter, more private area for the veterinarians to have those sensitive conversations with clients. We also still utilize it as an exam room. So a few years ago, the clinic only was in the current building that it is. We were fortunate enough to eventually have our facilities team connect the clinic building and the heritage building. So we have a little breezeway here, and we were able to expand some of our wards that we have. One of those wards is our parvo ward. I apologize, they turned all the lights off on me. So parvovirus typically happens in puppies who are not vaccinated for distemper parvo. It is very prevalent in our community and in our state, unfortunately. It's the only way to prevent it is by vaccinating with 4 rounds of distemper parvo. Treatment puppies tend to get diarrhea, vomiting, and lethargy first. There is no cure for parvo, only supportive therapy, meaning we start them on IV fluids, IV antibiotics, vitamins. We give them anti-nausea medication, and we hope that they recover, start turning around as far as what their white blood cell count looks like, start eating without vomiting, all of those things. I think we have a very good success rate. We typically have around 10 parvo patients, 10 to 15 parvo patients a year. They are very critical pets when they come in. They are very time sensitive and take a lot of time from our staff as well. We typically like to only house 2 parvo puppies at any time because of those reasons. We have previously had, I believe, 4 or 6 in here from one litter, and it wasn't a great experience for all. So we really try to not have that happen, but of course we will treat to the best of our ability. Over the years, we have noticed trends that take place from our Project Fetch partners. For example, we tend to see a higher prevalence of parvovirus coming from Gallup. Because we notice these trends, we ask that, for example, Gallup only send us puppies that are a certain age who have received 2 distemper parvos to limit the amount of parvo that might be incoming into the shelter. Once pets that are shelter or recently adopted from our shelter have recovered from parvo, they will either go back to their adopter or to their home, or they, if they're still in our care, they will go to treatment, dog treatments, where they will stay for a week. At that point, we parvo test them again. If they are negative, meaning they are no longer shedding the virus, they will get a bath and then be available for adoption. Parvo is incredibly contagious, which is why we have this ward and they're not just treated out in the shelter. It also lives in the environment for a very long time, which many people don't realize. So that is our parvo ward. So prior to renovating and expanding the clinic, our recovery ward was in the small area back over here. And in that little area, we also had our parvo puppies, which once our parvo puppies start feeling better, they're very loud. They want attention and they scream a lot. So it was not a very ideal situation for our cats to recover post-anesthetically. So we were lucky enough to now have our own cat recovery ward, where any of our donor-subsidized cats that are here for spay and neuter or our shelter cats, they recover in this nice, quiet room. The volunteers will bring them back into their little kennel. Once they're done, the volunteers frequently make rounds to come back here, check on everyone, check on the puppies, check on the large dog kennels. Typically, that's what the lead recovery volunteer does, is make the rounds. So here's, you see a kitty that wants some attention. This is little fuzzy gray girl. She's here for spay. So we try to keep our donor subsidized and our shelter cats separate, at least one on one bank, and most of the others on the other bank, again, because they might be harboring something that we're not fully aware of yet. So going back to recovery, the cats, they're away from the loud barking parvo puppy or the loud barking kennels, and they just have a more peaceful environment. As we all know, the stress of even putting a cat into a carrier and then transporting that cat from the cat house to the cat recovery ward, putting them in a new cage, all of those things can trigger stack into a lot of stress for the cats. So on top of that, the new noises, the new smells of the clinic. So we're really fortunate to have this separate area for them. In addition, we have our own clinic cat isolation ward, which is separate from our animal care isolation ward. The animal care isolation ward, the husbandry and medicating of those pets are all done by the AC team, and the veterinarians do the rechecks on them. This area is for any cats that have more severe upper respiratory infection. So they might need IV antibiotics, they might need nebulizing treatment, and just closer monitoring from our team. They may need force feeding, things like that. So we like to have them here closer to us where we can do treatments throughout the day as they need them. So as I mentioned earlier, all of the surgical packs have to eventually be sterilized and ready to go for the next day. Our autoclave is here. We have management and veterinary offices upstairs. Again, I apologize. We like to conserve our energy here, and all of the lights got turned off on me. So on this side of the Heritage Building, some of you may know this, some of you may not. Let me go back to here. So the Evans started Animal Humane out of this building. It was originally their home where they raised their family, started Animal Humane. It's very historic for our organization. I've been told that all departments on campus have at one point worked out of this building. It's now the clinic building permanently, but it's very special and important to us. One last thing with this building is now we are able to offer euthanasia in a more comfortable private environment. So rather than clients having to go through pre-COVID, having to go through the lobby where it's standing room only and they're emotionally devastated and in tears, they get to check in here on this side. One of our receptionists is on this side. Once the client and pet have been checked in, then they will come into one of our private comfort rooms where two technicians will walk the client through the process of euthanasia. All of our pets do get a sedation so that they are nice and calm, relaxed. The clients really like that we sedate them so that they feel they're not in pain through the process. So we are very fortunate to have these two rooms. It allows our clients to take the time to say their goodbyes to their pets as well. I apologize, somebody called me. As well as have time to process everything. And so most veterinary practices don't have the ability to offer this type of privacy and comfort rooms to their clients. So typically what happens is you go in to euthanize your pet, and then the next time you call with your new pet or a different pet, you're in that same exam room. And those feelings of emotion and everything and stress can come back. So we really are grateful that we have these private rooms. We also have a break room on this side, and of course, this goes out to the shelter. And I think that is the end of my tour, unless I missed something.
Thank you, Val.
You're welcome. I'll leave it on mute while you follow up here.
Good camera work. Thank you for doing that. I know you guys are there in operation. So that concludes our presentation this morning. Thank you so much for joining us today. I hope you found it interesting and inspiring. We couldn't do our work without your wonderful support. So thank you again from all of us in the veterinary clinic and here at Animal Humane New Mexico for just all of your wonderful support. You have a great day and take care.